The nursing shortage is hitting counties all across our state, and the California Nurses Association says it's not so much a nursing shortage as it is a staffing crisis. Thanks for joining us for your news at 6 on this Friday. I'm Tony Lopez.
And I'm Marley Ginter. Your reporter covering Stanislaus County, Nina Burns, is getting answers on the lack of professionals.
There is no nursing shortage. Let's be very clear about that.
Doctors Medical Center nurse Christy Carson says the current staffing crisis is a manufactured one.
In California alone, there's more than 150,000, 160,000 licensed registered nurses with active licenses who choose not to work at the bedside because of the working conditions.
According to the California Nurses Association, nearly 180,000 registered nurses are not employed as RNs across California in May of last year, and over 1.1 million nationwide. Carson says she spends many 13-hour shifts with no lunch and few bathroom breaks.
Nurses love patients. Nurses love their work, what they do. What is challenging is the working conditions.
It's a frustration echoed across hospitals in the county.
As nurses, we're there for the patient. We're there to advocate for them.
Radiation oncology nurse Loretta Burkett says she's seen staffing numbers dwindle while hospital systems report record profits.
It's profit over patient safety at this point.
Tenet, the corporation behind both Burkett and Carson's hospital systems, reported a net income of $4.1 billion in 2024, up from $1.3 billion in 2023. Where are you seeing some of that lack in patient care?
Patients sit in soiled linens. They don't get changed as quickly as they could if you had adequate staffing. A big problem is patients getting up to go to the bathroom and falling without assistance.
Registered nurses aren't calling this burnout. You guys are actually calling it moral distress and moral injury.
Burned out, I wouldn't call it burned out. We are made to work. We went through a pandemic. We can do it. We can deal with all of that.
And I see so many students say they want to give back to their communities, right?
A problem affecting even nursing programs. At Stanislaus State University, Program Director Michelle Bayorian says they're trying to increase class sizes.
So every fall and every spring we admit 40 students. It's not from a lack of desire, I think, from the school's point of view. It's more the lack of faculty and the lack of clinical sites.
Still, the university is attempting to keep that workforce right here in Stanislaus County.
We're actually making sure that 50% of those that we take of the applicants come from this area, because we know if they come from this area, they're more apt to stay and support this area.
But without funding, faculty, and fair working conditions, nurses say this cycle won't break.
Every single thing that we are demanding is related to patient safety, and we will always be fighting for our patients and our communities.
We reached out to Tenet Healthcare multiple times for their take on this, but we have yet to hear back.